Using neuromuscular technique evaluation, we found a myofascial trigger point at the levator scapular insertion. The radiating discomfort from that is to these hatched areas. We're going to treat this using a combination of neuromuscular ischemic compression, positional release, and muscle energy technique. Combined, they're known as INIT, Integrated Neuromuscular Inhibition Technique. The ischemic compression is applied for 5 to 7 seconds. The patient is asked to report on reduction in pain after a few seconds break and reapplication of pressure. This make and break compression allows for circulatory interchange as well as the inhibition of the neurological status of the trigger point.
There's less pain there.
Less pain now. Now I'm going to press in there and I want you to grade that pain as a 10 and tell me as I position you, just bring the head back slightly. Does that ease the pain a little?
Yep.
And give me a score out of 10 as I move your arm. Where are we now?
4.
Let the arm be totally relaxed. Let me have it. Now?
2.
Okay. I'll ease off the pressure and simply hold this to allow positional release to begin to further deactivate the trigger point area, to enhance circulation through these tissues, and to relax any hypertonicity in the local musculature, especially in levator scapula. After about 15 seconds of that, I'm going to take the patient into a different position and use muscle energy to contract the muscle isometrically. Can you turn onto your back? And just give me the weight of your head on my arm, putting the muscle at its restriction barrier. Could you shrug your shoulder gently into my hand, take your head back to the table. This contracts levator scapula. Not too strong, just maintain that amount of push. On releasing and relaxing, I apply compression to the shoulder to stretch one end, take the head into further flexion, side bending and rotating to stretch the muscle housing the trigger point. This is an absolutely essential component of the deactivation of any trigger point, restoring it to its normal resting length by stretching. And that should get rid of the trigger point activity. Using finger assessment methods, a potential trigger point has been identified in the gluteus minimus. On application of pressure to it, the patient is asked, does that hurt?
Yes, it was painful.
Does it radiate?
Yes.
Where to?
It's going into the buttock and the side of my leg.
I'm going to apply pressure to it for about 4 or 5 seconds and then lighten up for a few seconds and then repeat that over and over until you feel that the pain is reducing somewhat. Pressing now and lightening up. I want you to tell me at what point the pain begins to lessen, either locally or down the leg or in the buttock.
That's beginning to lessen now in the buttock.
Okay. I'm going to do something different now. I'm going to press on the point, create a pain which I want you to register as a 10, and I'm going to move your leg until the pain lessens. I want you to just give me numbers, just give me scores. What is the score now?
8.
Now?
7.
Now?
8.
Okay. Now?
5.
Now?
3.
Okay. I'm just going to ask you to hold that position. I'll support you. I'll stop pressing. And we'll stay there a little while. Now I want you to tighten the muscle where my thumb is. Can you raise your leg a little higher sideways? Okay, we have an isometric contraction there. And now release it and relax it and just let the leg hang down and over. And now we'll stretch that locally in various ways to try and achieve a lengthening of the muscle. When trigger points are located in sternomastoid, it's important that they are compressed by a pincer-like movement rather than by direct compression. Does that hurt?
Yes, it is.
Does it radiate?
Yes, it's
Where?
going into my ear and my forehead.
I'm going to press and then lighten up and then repeat. If the pain diminishes either locally or where it's referring to, can you tell me, please? Intermittent compression allows for a circulatory interchange, and the ischemic compression has a neurologically inhibiting effect. This starts to deactivate the trigger.
This is lessening in the forehead now.
Is it still less?
Still less.
Okay. I'm going to compress the point again. I want you to score a 10 as the degree of pain you're feeling, and then tell me what happens as I slowly reposition your head. So you should be able to score a 10 now. What's happening? Score?
7.
No.
5.
No.
3.
No.
2.
Okay. I'll stop pressing, and I'm just going to hold you there. During this 10 or 15 second hold, circulatory interchange is enhanced, and the muscle housing the trigger point is further de-stressed and deactivated. It'll become less hypertonic. I want you to lift your head gently and turn it to the right now. This is going to contract isometrically the muscle that we need to stretch. Now release it and relax it. Let your head turn to this side. Let me have a hand there, and just breathe in and breathe out, and we stretch the muscle. Following an isometric contraction, there's about a 15 to 20 second period during which the muscle can be repositioned and stretched. I'll just repalpate it, and I want you to tell me if it is less uncomfortable than before as I press on it.
Yes, it's much less.
Okay, fine.